Tuberculosis is an ancient disease, but it still affects millions worldwide and can turn deadly if not detected and treated. The best news? Today, most TB cases are curable with the right therapy and early action. TB is a bacterial infection, mostly targeting the lungs but sometimes spreading to the brain, spine, lymph nodes, or other organs. It is caused by Mycobacterium tuberculosis, a tough germ that spreads in tiny droplets when a person with active lung TB coughs, speaks, or sneezes. You can't catch TB from shaking hands or sharing food, only through prolonged close indoor contact with an infected person. Active TB symptoms are present and the person can pass TB to others. Germs are multiplying, usually in the lungs, but sometimes elsewhere. Latent TB, the person feels fine, has no symptoms, and can't spread TB, but the germs are still there, asleep. Without treatment, about 5 to 10% will develop active TB later, especially if immune defenses weaken. Persistent cough lasting 3 weeks or more, sometimes with blood fever and night sweats. Unintentional weight loss, loss of appetite. Chest pain, weakness, fatigue, swollen glands, bone, joint pain. Or confusion if TB spreads beyond the lungs. Close contacts of people with infectious TB. People with weakened immune systems. HIV, AIDS, diabetes, cancers, chronic kidney liver disease, young children, the elderly, or those with poor nutrition, living or working in crowded places, prisons, shelters, some healthcare settings. Sputum sample or body fluid tissue if outside the lungs. Tested for TB bacteria, chest x-ray or molecular GenExpert tests. Latent TB, detected with special skin or blood tests. Diagnosis and treatment can prevent it from turning active later. Latent TB, 3 to 6 months of targeted antibiotics to prevent future activation. Active TB, combo of 4 antibiotics, usually for 6 months, isoniazid, rifampin, pyrazinamide, and ethambutol. Most people become non-infectious after 2 to 3 weeks, but finishing the whole course is essential even if feeling better to prevent drug resistance. Drug-resistant TB requires more drugs, longer therapy, and careful specialist follow-up. Promptly identify and treat both latent and active TB. Good cough hygiene and ventilation. BCG. Vaccination prevents severe TB in infants, young children, not for adults. Early medical care for persistent cough, fevers, or after TB exposure. TB spreads by air from people with active lung disease. A cough over 3 weeks, fevers, or weight loss? Get checked promptly. TB is curable, but only if medicines are taken exactly as prescribed. If this clarified tuberculosis, tap like to help boost awareness, share it to someone who needs to know, and subscribe for trusted, evidence-based health videos. Like, share, and subscribe.